In 2024, A&E wait times were over 5.5 hours. Specialist appointment wait times were 18 weeks. And 22,000 people a year sadly die because of incorrect prescriptions. Facing enormous staffing, funding and resourcing issues, the NHS has become a political tool for all sides.
In the National Health Service.
Our NHS.
The NHS waiting list.
But these aren't the only challenges facing the NHS right now.
In many parts of the National Health Service, the infrastructure is still well behind the times and the technology is not fit for purpose, meaning that doctors and nurses who are already under immense strain do not have the tools they need to do their jobs, and they're spending too much time on admin and not the time that they would like to spend on patient care.
Doctors and nurses often have to wait to use shared computers. Many of these computers are so old that just waiting for them to start up takes time. In addition, there are different systems in each city, hospital, and department, and some still use paper. Having to use out-of-date systems all takes time away from NHS workers.
We know there's no quick fix for this system. AI has enormous potential for giving time back to busy medical professionals so that they can focus on care.
Let's take the issue of patients dying from incorrect prescriptions.
Some people on the National Health Service have up to 19 simultaneous prescriptions. It can be possible for drugs involved in those prescriptions to interfere and cause those patients harm. The National Health Service does have a system of structured medication reviews for people who are on more than about 9 prescriptions that will go through with a pharmacist and check their prescriptions. And that system is designed to really make sure that prescriptions aren't causing harm. However, there aren't enough pharmacists available, and we probably only reach about a fifth of the people who are eligible for that prescription checking service. There's an opportunity with AI to run through, in bulk, all of the prescriptions across the NHS to figure out where people might be experiencing harm or at a risk of harm, and then to find automated ways to flag up and alert pharmacists the opportunity to intervene and fix that prescription profile to be fully safe. The Incubator for AI has been working on an algorithm called MedGuard, which is used with pharmacists to help to alleviate the risk of harm. There are many other technologies that would be very useful in this space. For example, ambient technology that will take notes of patient interactions and might be able to provide automated discharge summaries so that you don't have to wait a long time to be able to leave a hospital. There are many opportunities to involve AI in triaging decisions to get people through systems more effectively or get people to the right kind of care. A lot of the time people end up waiting for a doctor when they could see a certain type of nurse much faster and get exactly the same outcome. AI should be able to point people to better care faster, and in doing so save both time and money for the patient and for the medical service. What we're talking about here is identifying simple processes that AI can help with to improve the standard of patient care. We know that what medical professionals really care about is time with patients and feeling the impact of their work and the care that they give. So all of these AI tools should be designed with giving that time back in mind to help people get the human level care that they deserve.